Minister for Health, the Honourable Mr Andrews. Euthanasia is a big issue in our Victorian hospitals. I'd like to clarify that euthanasia is when a doctor deliberately ends the life of a terminal or incurable patient. It can be classified as either voluntary or involuntary. Voluntary euthanasia is when a patient gives a formal request for the euthanasia to be conducted. Involuntary euthanasia is when it is conducted without this formal request and against the will of the patient. According to Professor Margaret Legalising, a euthanasia law expert, criminal law does not presently differentiate between euthanasia which is performed with or without the request of the patient. Both types of euthanasia are currently illegal in Victoria and carry severe criminal charges. This needs to change. There is a big difference between voluntary and involuntary euthanasia, and the law needs to recognise this and permit voluntary euthanasia. Patients who are suffering from terminal diseases are often in excruciating pain and want to end their lives in a way with minimal pain. Making euthanasia illegal takes away their rights, forcing them to live when they have no wish to. Those doctors who cannot stand to see a patient suffer like this are then forced to break the law to do what they believe is right. An example of this is Dr Cox, who was convicted of attempted murder for performing voluntary euthanasia. Margaret Legalising's book, Voluntary Euthanasia and the Common Law, states that his only crime had been to deliberately hasten the death of an elderly patient who was in excruciating and unrelievable agony, and who had begged him to relieve her of her suffering by administering a lethal dose of potassium chloride. He was only doing what was right by his patient, and the law is now punishing him. Voluntary euthanasia needs to be legalised, both for the rights of the patient and the freedom of the doctors willing to help them.
Please stand in your place.